right, we're going to be talking a little bit about some NAD. I'm going to talk about NAD clinically that I've seen. There's a lot of science, there's a lot of supplements, there's a lot of research, there's a lot of scientific papers saying X, Y, and Z and what it really does. I'll tell you from a clinical standpoint, I do NAD IVs at 400 milligrams 2 times a month. I'll backtrack a little bit where I was doing NAD 400 milligrams once a week. And I'll backtrack again to say what NAD even means, right? So it's nicotinamide adenosine dinucleotide. And this is going to be a precursor to make more ATP in the body, which is going to be our energy store for our mitochondria. So mitochondria is the powerhouse of the cell, and how we shuttle in energy and make energy in the body is going to be this specific, coenzyme and nutrient itself. Quite fascinating of what it does. It's the guardian of the genome as well, and actually has some research around increasing telomere length. At the edge of your chromosomes, you had 23 chromosomes split, and obviously this is what's kind of made your genetic profile from your mother and your father. And the telomere is at the edge of that chromosome, and it decreases with age. And this will tell us our biological age, not our chronological age. But how to test that, there's different labs companies out there that will test telomere length. Does NAD improve that? Potentially, it's not going to be a main factor. You're not going to feel that your telomere length is increasing. But clinically, of what I've seen with the IVs, just from an optimization standpoint, you get more energy, for sure. So as we kind of age through time, our mitochondria, I usually say, shrivel up. And how do you get them to not denature as fast or as quickly, and actually have strong mitochondria and cellular function over time? This is what that does. Neurologically is probably number one. There's more concentration, focus, and clarity. Almost like the Limitless pill with Bradley Cooper, where everything got a little bit brighter. It's very subtle. It's not like, oh my gosh, this changed my life. But over time, when you get more NAD in the body, you can kind of have more sustained concentration, more sustained focus, and more consistent energy through time. That's what I've seen clinically with the optimization standpoint. From a point that you use it for, opioid dependence, opioid withdrawal, Suboxone withdrawal, or if you're going into the cocaines, the benzodiazepines, and you're also seeing like heroin addicts use it. We've used it for plenty of different neurological diseases, and obviously drug-induced diseases as well. And what it does for the brain is quite interesting, right? So it increases gap in the brain. Or at these specific dosages, it can hit specific receptors in the brain. It starts from about 1,000 milligrams up to 1,200 milligrams. You got to use it consistently for anywhere from 3 to 5 up to 10 days consecutively. It will hit these specific parts of the brain. Let's just say an opioid receptor. It actually attaches into a MAO receptor in the brain. Suboxone does the same, but now instead of attaching onto it, it will desensitize that receptor in the brain to actually release that opioid or that receptor itself to actually almost like heal itself, if it's just in the layman's terms. So how many treatments will it take? It depends on the person and how long they've been taking that specific drug. But that's what I've seen clinically. Like, there's a lot of research into that. And, can we help support, neurological diseases or drug-induced diseases at the same time optimization? And I've seen that clinically with NAD. I've also used it for, chronic diseases such as Lyme disease, EBV, mold toxicity. And with those patients, we actually create oxidation in the body to help eradicate any of the viruses, pathogens, antigens in the body. But we also got to build back up their mitochondria. As much oxidative stresses that we build with the ozone therapies, the ALA, the high dose vitamin C, the glutathione. We want to build them back up, and I've seen that work really well for patients as well. To not push them so far down with those oxidative therapies, to actually start building them back up. So I highly recommend using NAD for optimization, but trying it out, consult with your doctor, consult with one of us. And then from the drug-induced or the just neurological diseases, those are, extremely, extremely beneficial. And, they don't always work, but clinically, this is one of the strongest nutrients I've seen at very low dosages as well. And it's quite cost effective to get on these therapies if, you've been dealing with a chronic disease or a neurological disease or a drug-induced disease for 10 plus years. It's quite fascinating what it's done clinically. Research is going out there, but NAD, can't stress it enough. One of the most powerful things that has changed my life personally, and it may work for you as well.